What does that even mean? Acceptable response. What does that mean?
There we go.
What we want to have happen with that DMARD. A good outcome. That means that it's acceptable, it's effective. Anybody want A? Is that an outcome we want from that medication? Symptom control. Okay. How about B? Okay, so you're looking for things that are a good outcome. Medication's doing what it's supposed to be doing, right? So you want A and B. Anybody want C? Yep. And D? And E? No, that's not an outcome we want. And F? No. Are we okay with how you process through that question? One by one by one by one. Acceptable response means is the med doing what it's supposed to do? Yes, it is. Yes, it is. Yes, it is. So just one by one by one. Don't try to guess whether there's all are correct. One is correct. Oh, we haven't had 4 correct for a while. Don't try to guess your way through that because it's random. Well, this is the way we set that up. Thought about that. Are you saying B as in boy? Okay. I heard a little bit of C. How does that drainage get transmitted to you as a caregiver? Contact. So tell me what that means. What you touch. So what are you going to wear? Gown and gloves. You would wear a mask if it got transmitted how? Droplet precautions for breathing it. So as caregivers, sometimes we overkill it, which is good. Like, oh, wear it all because I don't want any of this stuff. Stay home. However, when you take your NCLEX, they want to know if you know how it gets transmitted. That's your question. So they don't want you to just wear it all and do it all. Caregivers, sometimes we overwear, which is certainly fine as a nurse. When you're taking your NCLEX, you're answering questions. How does this get transmitted? Therefore, what do I need to wear to protect myself? So this is a draining wound. You're going to wear a gown because you may come in contact with it because you're changing lens and giving a bath, of course, and then gloves. Are we okay with that kind of question? That could apply to anything, any scenario that you could be given. Oh, could they all? Could you put that one right on the test? Oh, that's
butterfly
another,
rash.
not in this case, but on some questions, that's another priority. I just said initial, like what is your initial action as a nurse? So that may be when that's priority action. On this case, it's talking about initial finding action. Okay. We don't know if he's having any symptoms. We're not having call the squad, right? And we don't know if he's having any symptoms. We've been advised some kind of treatment for something that doesn't exist. And we don't tell clients not to worry. So by the process of deduction, did he have a history that he's at risk for a severe reaction? We don't know. Anybody have a thought on that? Correct. Typically. So which one of this group might have repeated exposure to latex?
A.
A. why do they have repeated exposure to latex? They wear gloves. But if you were sitting here thinking, I don't even know why cosmetologists wear gloves, right? If you've never had your hair color ever been in a beauty salon. I don't know the answer to this. However, what do B, C, and D all have in common? Group settings.
Yeah.
They're all in close quarters, right? The homeless, perhaps, bodies maybe touching other bodies, same thing for C and D. So if you have no idea what cosmetologists do, or that they would ever potentially wear gloves, I have no idea how to get. You could maybe guess your way through this question based on the fact, well, I do know that B, C, and D seem like they have a lot in common because there are lots of people maybe in an area concentrated with each other, and I don't really see that. Can't really picture that in a beauty salon, that there would be cosmetologists that would be touching bodies and in close proximity. So you might have guessed A, even if you didn't know that they wear gloves to color hair. This is kind of like the 135 question, but maybe bring a little bit of a break. Anybody want A? And B?
Yes.
C? What does
No.
wall-to-wall carpeting mean? Like in here. Your carpet goes from one wall to the other.
Right. Nothing's wrong
Yeah,
with that.
that's not a problem.
D.
Familiar with terminology. So we decided we don't
And
want
E.
C.
Yeah.
We went D.
Yes.
Obviously an E.
Yes.
Yeah, that's pretty straightforward.
B.
B.
Yeah.
Elevate
B.
uric acid level, and besides, are the rest of those normal? Okay. Oops. Oh, sorry.
It's either C or D.
Some of you jumped on an answer before reading all the answers. Risk factor questions, add them up. One doesn't negate the other one if you're tallying up risk factors. Because just because I'm a smoker and if I jog every day, that doesn't negate the fact that I have a risk factor of smoking. They're risk factors. So yes, quality of life maybe, and how you can sort of, but you're not doing that when you're doing this as a student. You're tallying up the risk factors. How many does the person in one have? How many risk factors does she have? None.
None.
Maybe a female. So we'll give her one, maybe. So if you're kind of tallying up, how about the person in two, in B? One, asthma. And C?
Two.
Older,
And
alcohol. And how about D?
3.
Older, female, and smokes.
Yep. So D.
Add them up. One doesn't negate another one. If you have a risk factor, you have a risk factor, and it doesn't matter if you try to counteract that risk factor because you do something else that's.
Would it be sedentary also be a risk factor?
Absolutely. Yep. So you could be 4, but if you were, yeah, that's a great point, Journey. So even if you weren't sure about the male-female thing, the one in D definitely has 3, if not 4. Correct. And by the way, it's 4. Tally them up. One doesn't negate the other one. If you're a diabetic and that's a risk factor, you have a risk factor, even if you have all the other things that are great in your life. And sometimes you all, I heard somebody jump on C right away, just he's 70 and he drinks, add them up as you go.
D.
Mm-hmm. You said autoimmune disorder? Yep. What are you looking for? The wrong statement. So, which one of those statements, after you provided me with education, would be the wrong statement that you would need to correct as my nurse? A. If you're having pain, I shouldn't keep doing what I'm doing because perhaps I'm overstraining something if I'm continuing to have pain. And some of you all went right away to a correct statement, and you would have missed that question. So pause for a little bit. You provided instructions. Am I looking for the statement that means I understood the instruction? Or am I looking for a statement that means I need further education or further instruction? Stop and pause for a little bit, make sure that's clear in your head what you're looking for. Sometimes I'll see students write down a scratch paper looking for the wrong answer, something like that, so they keep their brain, because you're gonna be upset with yourself if you know the content and you answered that wrong because you just didn't read the question. I think it's helpful once you got some studying in, next Monday or something, do 20 NCLEX questions. You know, close a room at home, if you're able to, or go somewhere where you can. Set my timer for 30 minutes. I'm gonna tackle, 20 NCLEX questions tonight, just cruise through them and see if there's something I'm missing, if there's something that I'm not understanding how to answer a question correctly, and just put a little bit of concentrated time. Don't do 120, just do something realistic. Close yourself in a room, set your timer, and do some NCLEX questions so you kind of get in the groove of these kind of questions. And if you're finding you're missing something like that, oh, I gotta slow down, I'm missing key information. What am I missing that maybe I'm doing a pattern of something or another? We didn't study osteoporosis today, but that seems to be a popular thing with ATI and some other worlds. And this one should be pretty much easy. Get your way through. C and D. Anybody else have any other ones you want? B, postmenopausal. Which we'll talk a little bit more about that in the reproductive in a couple weeks. Well, I don't really know about osteoporosis, but I do know the postmenopausal people will tell them to do bone density tests, so I wonder if that has to do with that, and maybe you could have gotten to B just by knowledge of things like that. Incompatible means inconsistent with those findings. So is inflammation consistent with the finding of swollen red worm? Yes, of course. What about C? Infection? Yes. What about D? Yes. So that's how you can get to B even if you're not really going. Incompatible was your key word there. Anybody have a thought? Okay, because that's got, the word has itis in it. Again, if you aren't sure, if you guess your way a little bit, okay, let me put that word down. Maybe I can get there even if I'm not 100% sure what else physiologically might be going on with that disorder. Anybody want to use mouthwash once a week, brushing your teeth once a day?
C.
Why did you pick those? All right. How often should I brush my teeth? More than once, right?
Yeah.
I want you to do all that crud out in the morning and I want you to get off for your bed at night. So at least more than once a day. Think about, put that in your own world if you need to. Even if you don't have thrush, what else would you recommend to your kid or your client or someone else about brushing your teeth? Hey buddy, you gotta at least brush your teeth twice a day, right? You gotta get up in the morning, brush them, brush them, do that. So we can roll out C based on that. A, how often should I use mouthwash? More than once a week, especially if you've got thrush. So A probably won't work either. I'm down to B and D. I've never heard of red meat associated with thrush, so
Yeah.
that just makes good sense. You don't want to use something irritating. D. Do we know what the dose of allopurinol is? But do you know it that's how you can figure out that A was not the right answer, was my point. We don't know what your dose, you may be at maximum dose right now, we don't know that, so why would we ever tell you when we're gonna have you stop if you double your dose? Right, and stopping it and giving them aspirin is not anticipated, right? Stopping it altogether, but adding to the therapy is probably gonna be what's gonna be the next choice of action. Why did you pick A? Because it's low calorie. Correct. So paying attention to those kinds of things, because initially that might have sounded like that was a good idea, like snack between your meals, get some extra calories in, right? But the low calorie was the piece of that. So paying attention to that, not making assumptions about a history. Again, maybe there's risk factors for something. Do you know enough about whether they sit all day, whether they're stressed out all day? Stress exacerbates a lot of these disorders we talked about today. Do you have information that that person is stressed or not? So if you're looking at risk factors, things that will exacerbate your condition, I don't know. You maybe says I have to drive to work every day, and you're dealing with his fibromyalgia. Unless it tells you, you don't know if that's a 5-minute drive or a 50-minute drive, right? So what information do I have to base my answer on? Probably one of the biggest things we've talked about all day today is there pieces in the history that might play into you giving him Celebrex or not, or you giving him an NSAID or not, or something like that. So is there anything that's got a red flag for you to say, gosh, I should really think through this, whether that's a risk factor or a problem or not? One more question. So sorry.
What the heck?
Not sorry. Okay, who's got questions for next week? Respiratory, cardiac, or immunology, anything, any of the above? Sometimes I'll see students on test B specifically will write out a little diagram of the heart before they get started. That might be helpful to see left-sided, right-sided, how the blood flow goes. If I got left-sided heart failure, why I'm going to have issues that I'm going to have. If I have right-sided heart failure. What is preload? I'm just trying to think of stuff that I know that's kind of trips some students up. What's preload? What does that mean? Explain that to me. Preload. Okay, it's the fluid coming at the front end of the heart. All the stuff, the fluid that the heart has to deal with on this front end is called preload. Pre means before. So it's all the stuff coming at it. What's one medication you can use to decrease your preload? I said it's all the fluid coming in on this front end. How are you going to decrease your preload? Diuretic. Preload is lots of fluids going in. If your goal is to decrease the preload, you got to stop that amount of fluid. So stressing the heart out is dealing with too much. You're pouring way too much water in your bucket, and you're overflowing it, and it can't handle it. It can't deal with it. Putting so much in, you're going to do that by getting rid of preload, decreasing your diuretic. What is a medication that's going to increase his heart rate? He's going to take a medication that's making his heart rate be 110. What's it going to do to his preload? Increase it or decrease it? Is it going to stress the heart out more or less? It's going to increase your preload. It's increasing the stress of the heart when you're pouring that bucket of water, that water into your bucket really fast, right? So preload is how much water coming in on the front end. So too much fluid on board, too fast of a heart rate that your sponge, your heart cannot keep up with that. And a ticket for decreasing your preload is giving a diuretic to get rid of that fluid from not coming in so much, right? What's afterload? Okay, resistance against the contraction. What causes you to have increased afterload? The afterload is the point where the aorta pushes the blood out, and everything it has to do to get it out, cardiac output, circulating, and back in. Constriction, vasoconstriction. It causes decreased ejection fraction. You're right. So afterload is the resistance that your sponge pushes up against to push the blood out every time. So if you have hypertension, you have high blood pressure, you're pushing through a little drinking straw when your heart's trying to push blood through there, when it should be pushing through a nice big open vessel, right? So high blood pressure is the biggest culprit of you having increased afterload. That's a lot of work for that sponge. You're trying to squeeze your sponge out of the water that you've accumulated because you washed your vehicle, and you're trying to squeeze it out and drain it out of your sponge through a tiny little drinking straw. That would make no sense to me. Hook that sponge up to a big wide hose, and you're going to be able to much more effectively squeeze the blood out. Same concept. So knowing that it's high pressure for that sponge to go through caused by hypertension typically, what's the medication to decrease your afterload? An antihypertensive of some sort. You guys good on that? Be clear on preload and afterload, because that's going to be important to know. What does an inotrope, positive inotropic medication mean? Inotropic. Correct. A positive inotrope will improve the squeeze. Inotrope means squeeze. So those are things like dobutamine, right, that improves the squeeze of the heart. I remember dobutamine because it's got the word butt in the middle of it and kicks butt. So improves the squeeze. It's a positive inotrope. What's a positive chronotrope? Chronotrope. What does chrono mean? CHRONO.
In order?
Time. You know, like
Time.
chronological
Time.
order.
Okay.
So it increases the rate. A positive chronotrope increases the rate. So those are things I will what do you need to do when you give the patient digoxin, lanoxin? Check their heart rate. What does digoxin do to your heart rate? Lowers it. What does it do for the squeeze? Correct. Improves the squeeze. So why do we care? Why do we want to give that? Okay, same car wash analogy. Your neighbor kid comes over and you say, you're done washing your vehicle, and you give the sponge, you're like, squeeze the sponge out, get all this water out of here so you get this finger out. And your little neighbor buddy is going like this with the sponge. And you're like, you know what? You'd be a lot better off. We'll get more out of that thing. Let me tell you something. Because I learned from a really smart instructor. So squeeze really hard on it every time and just slow down. Make it more effective. Every time you squeeze on it, instead of going like that, not getting anywhere, squeeze it harder each time, slow down, you're going to get more out each time. That's what melanoxin, digoxin does. Difference between how do you know someone is having a STEMI? ST elevation in, what's the rest of that definition? In 2 contiguous leads. The definition is 2. What does that even mean, contiguous leads? Okay, correct. You have a 12 lead EKG that you're looking at, right? 12 lead EKG means there's 12 views of the heart going on all at the same time, right? Contiguous means 2 leads sitting side by side are showing ST elevation. How is a STEMI different than a non-STEMI? Okay, what does that mean for your patient? You've been diagnosed with a non-STEMI, you've been diagnosed with a STEMI. Which one's worse? STEMI, what's worse about that person than that person? Correct. Are they both MIs? Yes. So what does ST elevation mean for that patient? Why did you say that was worse than this? Correct. They both are MIs. They both are injury, because they're both MIs, right? Mm-hmm. But the ST elevated one is showing ischemia, which is a more severe problem than injury, right? They both are MIs, STEMI and non-STEMI. They both have cardiac injury. A STEMI is ischemia that goes with that, which means not good, right? Because there's ischemia. Talk about nitroglycerin teaching at home. I'm taking this bottle of nitro home with me. What do you want to tell me about that? Keep it in the same container. Keep it in the dark container that it's provided in. Yeah, absolutely. What else? How many can I take? 3. What do I do when I take the first one? Sit down. Why do you tell me to sit down? Gonna vasodilate you, hopefully. I've taken 3. I've got nowhere with my chest pain. Okay. Unstable versus stable angina. If I'm having chest pain and I sit down and it gets better, which one is that? Stable. We were chatting, I was talking a little bit at lunchtime about all these meds. Keep it simple in your brain. I just do like a table. Here's the med, like digoxin. The next column is what does that med do? It improves the squeeze, it decreases the heart rate, right? So if I know what it does, the next column could be, then it would be smart for me to use that for something like cardiac failure, right? I'm gonna improve the sponge squeeze. And the next column could be maybe something unusual, different, caution, important about that particular med. Next line, next row, different med, same concept. And when you're talking about actions, are the meds working on the functionality of the sponge, like improving the squeeze, or is it dealing with the electrical impulses? So that might be another way to get that. You set it up nicely in a table like that, then you can cover it up with your little index card or somebody's quizzing you on it and move forward through your table. Then when you pull it out for your final, you don't have meds stuck all over the place in your notes and like, oh Lordy, I can't find them all back and can't remember what's what. Might be something you want to try. Keep it something simple when you write your pathophysiology, like ARDS. What is ARDS? Don't tell me what ARDS means. What does that really mean to your patient? Oxygen don't go up no matter how hard you try. That's the kind of pathophys you should write in your notes. Exactly like that. Something that makes good sense to me that I don't have to explain it to somebody else. If you put refractory hypoxemia, some of you are like, I don't even know what that means. I'm gonna write something like that where the oxygen doesn't go up, no matter how hard you try. So that's my recommendations for notes. You're always welcome to you're always welcome to show us your notes if you have something that you think, am I on the right track? Too much, too little. Don't write down shortness of breath for all your respiratory disorders. Don't write decreased O2 sat, 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 not stat. If you have questions between now and testing, give us a holler and we'll do what we can to help you out with that. It's gonna be short, Matt, if you're shorthanded by 2 minutes.
Yeah.
Yeah, we keep talking. If not, have a great rest of your week.